I'm Dr. Kellie Lane with Augusta Cardiology Clinic. I would like to talk with you a little bit about women and heart disease. Heart disease is the greatest threat to a woman's life. 1 in every 3 women will die from heart disease. In the United States alone, more than 500,000 women now have cardiovascular-related illnesses, and we believe this is related to an increase in all the risk factors that lead to heart disease in women. We have more women who are now diagnosed with diabetes and hypertension. More women are in the workplace and therefore under increased levels of stress. There is also an increased incidence of obesity and tobacco use among women. The symptoms in women also can be different than what we've been recognized as classic symptoms of heart disease in men. Oftentimes women will simply develop fatigue or shortness of breath. They often will develop symptoms other than chest discomfort. Often the discomfort can be experienced in other places like in the jaw or in the back. The symptoms can be very similar to indigestive symptoms or to symptoms that you experience during menopause, but we ask that you see your physician and that you have an EKG performed to make sure that there is no underlying heart disease. We also recommend that women get very involved in their own health care, that they go in for frequent visits to have their blood pressure checked, to be screened for diabetes, and also to have their cholesterol checked. We ask that women also be very concerned about an adequate exercise program so that they can maintain a more ideal weight and that it will overall make them healthier. We ask that each woman become her own advocate and become involved in her own health care.